Hello, everyone. It's Dr. Amanda here, and I'm your plant-based lifestyle physician and health coach who is here to educate and empower you to make healthy decisions so that you can live your most abundant life. So, of course, I have to give my disclaimer that the information that you hear on this YouTube channel is for informational and educational purposes only. And if you have any specific questions about your own health or diagnosis, please contact your own primary care physician because we are not here to diagnose or treat or cure any illnesses. All right. So I have a special guest with me today, Dr. Rashmi Schramm, and she is a board certified family medicine physician and a certified integrated health coach. So welcome, Dr. Schramm. How are you doing today?
Thank you so much, Dr. Amanda. It's my pleasure to be here with you.
Yeah. So go ahead and introduce yourself to the audience. I gave them a little snapshot, but I'm sure you can tell us better about yourself.
Yeah, so thank you. I am a family physician. This is my 21st year of practice. I'm also an integrative health coach, and I'm also a meditation teacher. And so I combine all of those, and I'm the founder of a company called Optimal Wellness, and I run one-on-one meditation and coaching sessions, as well as group meditation and coaching sessions. And we incorporate a lot of lifestyle into all of the coaching and including the meditation too. And I bring in a lot of ancient wisdom from Ayurveda from some of my training that I've had.
Wonderful, wonderful. So a lot of people hear about meditation. So can you explain to us exactly what meditation is?
Yeah, sometimes it's just a hashtag, right? Meditation, mindfulness, all of that stuff. So they're really simple definitions. And so, let's start with mindfulness first, because that's also thrown around a lot. And mindfulness is just a way of being, right? So mindfulness is the way that I define it. And most people would agree that it is just the act of paying attention to this present moment. So like you and I, we're paying attention to this present moment without judgment and with curiosity. And so it sounds really simple, right? But then
it's hard.
we know it's really hard. It's not easy. It's a practice. That's why it's a practice. And so with all the conditioning, with the way that our society is and culturally, and just our fast-paced, distracted world, most of the time we're not paying attention to this present moment. If we are, we're judging, which is not always a bad thing, because we do need to know whether something is good or bad, but sometimes it really takes up a lot of energy. And then the curiosity piece can sometimes go away as well. So it's just paying attention to this moment without judgment and with curiosity. So that's mindfulness. And there's all kinds of other components to it that when we have more time, we can get into it if you'd like. And then meditation is a formal practice of mindfulness. And so meditation is also an incredibly simple definition. It is just moving from activity into silence. And when we do that, either silence or stillness, you can kind of use either one of those. And when we do that, we're really just paying attention again to this present moment with curiosity and without judgment. And, there are different kinds of meditation. I teach a guided meditation, and I also teach a mantra-based meditation. And so it can be just as simple as a meditation can be defined as 2 minutes of sitting down to notice your breath. And every time you find that you're distracted, you just come right back to your breath or the mantra or the guidance. And again, with curiosity and without judgment, including without judgment for yourself, which can sometimes be the hardest thing, right? So I hope that helps set the stage for what meditation is and what mindfulness is. And meditation is the fastest way to grow our mindfulness muscle, if that helps.
Okay. Yeah, I never thought of mindfulness that way. Like you said, you hear these hashtags and things going on, and you have in your mind of what it's supposed to look like. And like you said, the judgment comes, and that's a big thing that I have problems with. So I'm glad you're here to help us through this part. So yes, thank you so much for that. So how can one actually meditate? Because you hear certain things, like you said, there's certain activities that you can do. You do guided or mantra based. Can you tell us a little bit more about the mantra? Like, what does that mean? Because I can say for myself, I've heard that, but do I really know what it means? So explain that a little bit more for us.
Yeah, so I teach a specific kind of mantra-based meditation that can be traced back to about 4,000 or 5,000 years. And it's based in a Vedic tradition, and it's based on the lunar cycles and things like that. So in that sense, in that particular setting, a mantra is very, very simple. It is mantra in Sanskrit is mind vehicle, right? So a lot of the mantras that we use just for the vibration. and we use it as a vehicle for the mind. And so we say, we really just give the mind something to do, because our minds need something to do. And when the mind is doing something, we, the essential self, can kind of slip past the mind a little bit sometimes. And so that's what a mantra means in that particular setting. But we know that we can, it's morphed into, this is my mantra, this is, and it can be something that you repeat to yourself as well. So there's not like a wrong or right way to use that word, but in this setting, in the mantra-based meditation, and there are actually multiple kinds of mantra-based meditations, that's generally what we're using, is something without a meaning, but just for the vibration. Because once there's a meaning, the mind takes off with all the thoughts that are associated with that meaning.
Yes, that's so true. So again, we go back to that no judgment thing.
That's right.
So that's what we have to stay key on. So no judgment. So if one wanted to meditate and they feel like they're like, okay, I can't sit still, because you go from to stillness or silence, but you're like, my mind just keeps going, I can't do it, so I just give up on meditation. So what would you say to someone that says that to you?
Yeah, that's a really common thing. And in fact, that was the case for me too. So it's not like I grew up in an ashram and went off to the mountains to meditate for like a couple years or something. It was a really messy, hot mess of a journey that I've kind of gone through with my meditation as well. And I have the same kind of brain as everybody else. It wants to do 65 things the second I sit down. And so one of the things that I recommend, if somebody really is just really anxious or really high emotional state and they really find it difficult to sit, you don't have to sit. You can practice mindfulness when you're just going for a walk, right? And so connecting with nature and just noticing what's around you when you're walking, when you're moving, sometimes that can dissipate the energy. So that's one of the first things that we'll do if I'm working with somebody and they really find it difficult to even sit down for 2 minutes. And sometimes that's the case, that's okay. But really just go for a walk outside. Look at this, if it's at night, look at the stars, look at the sky. If it's during the day, look at the clouds, look at the trees, listen for, even if it's traffic, just listen for it. Listen to see how your feet sound when they're hitting the pavement. Listen, just paying attention without any, electronics on us can be a very meditative thing. And it can be very difficult because we're used to dings and this and the other, or listening to a podcast. None of these things are bad, but if we're really trying to become more mindful, that would be a really easy and fast way that I recommend. I also, teach some breath exercises too, because a lot of times when we're just working within the breath, it's sometimes easier, again, for us to be able to do something to hit some of that still spaces that are already there. And then the next thing I would say is, when somebody's ready, is just to, again, practice that non-judgment with themselves and be really compassionate with themselves. I think of my meditation practice as my ultimate self-compassion, because I always want to judge, oh my God, all I did was bring myself back from my thoughts for 30 minutes, but ultimately that's okay. That was still a valid, perfectly, imperfect meditation session that you had. So it's just a matter of bringing yourself back to okay, that's all right. I had some thoughts, big deal. I just come back to my mantra. Okay, well, I was, in some other place. That's all right. Just come back to my breath, whatever it is. So it's just a matter of practicing it, right? It's like anything else. When you started working out originally, you couldn't have been as good as you are now, or running, right, or anything, right? So it's just a matter of building up that muscle little by little by little.
Yes. I love that, because I'm like I said, when I try to do meditation, I'm thinking, okay, I'm you think, and then you're a laundry list of stuff goes off in your head. Okay, I do this, and this. And like you said, if you just think about, okay, I'm wandered off, I can come back, but that's still meditation, because you're there, you're in the moment, trying to be mindful of what you're doing. I really like the walking one, because I had to discipline myself to do that, and not try to take something and listen to it and like that. Cause I'm like, you try to do, several things at one time to get them checked off your list. Okay, I have to listen to this podcast. I have to go through this, seeing me, and I can watch it while I'm walking and exercising and do all that. So, so letting yourself go free is good to know. Yes. So now that we talked about what mindfulness is and what meditation is, can you tell us, does this actually help when someone is stressed or overwhelmed? And if so, how does it help them?
Yeah, absolutely. So stress, as the way that I see it, is, or it's the perception of a threat, whether it's physical or emotional, right? And so that's why different events or different stressors affect different people differently. So it is the perception of a threat. And so, it can be like a deadline that's looming at work. It can be an actual physical threat. I mean, it can be a variety of different things. Most of the time, it's related to some expectation that we've either set for ourselves or society has set for us. And it doesn't mean the stress is not real, but just so we can understand what stress is.
Mm-hmm.
And so that's the first place to start. And so what overwhelm and stress can create for us is this overdrive within that sympathetic fight or flight response, right? And so we've seen that. We've seen that over the years for sure. And what that can do when we live in that fight or flight response is we start to see chronic inflammation, which is not helpful. Acute inflammation can be helpful when we're healing from something, as you know, but chronic inflammation leads to a whole host of other chronic ailments and illnesses. And I know that you work with patients in groups and one-on-one to help them decrease their chronic inflammation with lifestyle. Yeah. And so, and meditation has been shown time and time again to help with that as well. So the way that meditation or even just mindfulness works, the reason it has survived all these thousands of years is very, very simple, right? All of these things that we talk about are just so simple and they're free and they're side effect free.
Yes.
Just like the food is medicine, right? So
yes.
So basically we move from that sympathetic fight or flight, go, go, go. Even first-time meditators will move into a parasympathetic rest and restore response. And what that does is a whole host of things, right? So within the sympathetic response, we've got higher blood pressure, higher heart rate, we're taking short, shallow breaths. The blood flow in the body is completely different than in the rest and restore response. So for example, just simple ways to think about it is when we're stressed, like if we think we have to run from a saber-toothed tiger, then it's, we've got blood flow in the brain to different areas. Like we've got blood flow in the limbic system and not in the prefrontal cortex. We've got higher blood flow in our skeletal muscles because we might have to run and find the next cave. It's not a great time to worry about reproduction. It's not a great time to worry about, digestion. So blood is shunted from all of those organs and into the skeletal muscles. And so exact opposite stuff happens when you start to meditate. And so what happens there? The blood the blood flow returns back into the reproductive organs, into the gastrointestinal tract a little bit more, fluidly. The blood flow within the brain itself changes within just the first hour or two. And so we see actually blood flow changes more into the prefrontal cortex, which is our executive functioning, creativity, all our access to all our intellect and all of that, and less in that amygdala, the hypothalamus, and that limbic system. And so those are just short-term benefits. How that can show up is decreased heart rate, decreased, blood pressure right away. I mean, really just right away. We start to notice digestion improves pretty quickly, and really quickly cortisol levels can drop as well. And then over time, the brain starts to rewire itself. I mean, the brain is always rewiring itself, but we can really begin to have more access to a calm energy and creativity, even in very stressful situations, if we stay and practice this particular way of being when we're in stressful situations. And so what we start to see in meditators within just a few months is the gray matter in the prefrontal cortex is actually much thicker and larger. It's heavier. The actual connection between the limbic system and the prefrontal cortex actually starts to get stronger, to where there's more of a, hey, is this really something that we need to worry about? Or can we work on this thing that we're working on now? Like, so it can translate like that. So, and then over time, like we can really, I've been able to help folks just get off blood pressure medicines, get off, certain medications, because then you start to have less of these behaviors that can be a little bit more addictive when we're sitting in a very high stress response system. And, even neuropeptides start to change. So within like 6-7 weeks of pretty regular meditation, of one of the kinds that I teach, the guided meditation yoga nidra, we'll see 35-40% increases in serotonin, in norepinephrine, and up to 60% of dopamine, endogenous dopamine. And so that then translates to a lot of folks testing better, right? They've done lots of studies where they test folks, right before they start a meditation program, and about 3 or 4 weeks afterwards, they start to do better on their tests so they can concentrate more. They've got more focus. They report feeling calmer. We know that it's very, very helpful for anxiety and depression and even PTSD. And so the reason that they're helpful for those isn't just because you feel calm, because yes, it's a nice thing to feel calm, but there are all kinds of other mind-body benefits that are happening behind the scenes. And that's just the tip of the iceberg.
Right, right. I'm like, oh my gosh, like that's so much that's there. Like and like when I said no meditation, that's what you think of, just, oh, I'm just going to be calm and then I'll be okay, but all those other things that's going on physiologically and in your body that's changing, and it actually I work out for the better. So you mentioned a lot of things. So like just with meditation, and I'm big on trying to get people off medication for like things like their blood pressure, excuse me, depression, anxiety. So we see that everything works together. I usually tell people that you are one person. You can't take your, heart disease over here, your diabetes over here, your stress over there. No, it all works together. So this is why I like for people like you to come on and let us know, because I focus on the food, like you said, but there's so many other aspects that our body needs to actually help us to become a well person. So I like that your company is called Optimal Wellness. So thank you for that. What are some things that people should think about when they want to start a meditation practice? Like, what should they look for? Like, I know you do coaching, things like that. So what should one look for when they can find something that would work for them?
Yeah. So it's really simple. Really, what people can do is just set a timer for 5 minutes and just decide to sit down and notice their breath. And that it can really just be that simple. If you want a little bit more, like if they're ready to dip their toes in, honestly, for my patients, I have them go to one of the apps that are available. There's some really good apps that are available. So there's Headspace, there's Calm, there's 10% Happier. They're a fraction of the cost of some of the other things, right? So the thing is, you've got to be a little bit careful because they have so many options on those things that can become overwhelming. And so that's sometimes when I start to see folks, because I really just streamline all of that. And I think of it as like, hey, you can skip like 5 years of bouncing here and here and here and get into this really deep meditation when we do this stuff. So either find a group, either find, just an app that you like, or I have some evidence-based, free, completely free, short meditations on my YouTube channel. If somebody wants to get started, those are always available. I have some longer ones that are on there too. And I have some pretty good feedback on those. And they're really very evidence-based, meaning they've been studied, at least dozens of times, and they've shown some of those benefits that I was talking to you about. And so that might be an easy, fun way to do it. I also have group programs that I'm constantly doing, and they change from, quarter to quarter. So next in 2022, there's going to be some new programming coming out, and they're usually like really very new meditators that pop in there. Sometimes some very seasoned meditators come in too. And then we have discussions, and we have, I just give them support, but we usually do live meditations together. And we talk about some of these things that you and I are talking about.
Excellent, excellent. So I'm glad you brought that up, because that was going to be my next question. That what do you have coming up that if someone like listened to this video today and they're like, okay, yes, this is something I definitely want to get started with, but I've tried a few things before and it's just not working. So I definitely need a little bit more help. So how can they find you, and what do you have coming up?
Yeah. So the best place to find me is on my website, and that's optimalwellnessmd.org. I have all of my, things that are coming up there. I have a new group program that's going to be coming up in January. It's called The Power Within, and it's going to incorporate actually some Ayurveda and some ancient wisdom lifestyle wise, in addition to meditation and mindfulness practices. So that's going to be really fun. We're going to have some guest coaches in there for yoga and things like that. So that's one option. I always continue to work with folks one-on-one in meditation and also with coaching and meditation too. So I am always, available on social media too, and I'd love to connect. And so I'm on Instagram at just Dr. Dr. period, and then my name. I'm on Facebook and I'm on YouTube, like I mentioned already. So those are all the ways.
Well, wonderful. I'll definitely link all your contact information in the description of this video. And thank you for coming and sharing with us about meditation and how it can impact our health for the better. So I'll definitely encourage everyone to check out Dr. Rashmi's YouTube channel. And like she said, she has a program starting in January, but you can start now in December as the holidays are going on. And then when her program opens up, you can okay, yes, I've already experienced you, so let me get on top of this now. So thank you once again, and we'll see everyone soon. All right, bye-bye.
Thank you.